There you are. She was asking about the this like kind of fat stuff here. That's just like the back of the eye. So it's kind of bottom part of the brain, back of the eye stuff. This one's got some really good optic nerves in it. Actually, that is an optic nerve, which is really nice. Oh, yeah, that is one of the 2 cranial nerves that you do need to know in the brain. So optic nerve. Now, I'll be honest with you, once I get the dura mater off, it's probably not going to look good.
Oh, okay.
But I appreciate your initiative.
Trying.
So you want to start trying to cut away the dura mater. Fortunately, there's some of it already cut away. So hey, tentorium cerebelli, just had a quiz on that today. Just gonna cut around that. Peel as you go. And the dura mater does peel right off as you cut it. These are really dull scissors. The dura mater's tough, but it's not that tough. We'll notice that the sheep doesn't really have an appreciable superior sagittal sinus like humans do. It's kind of it doesn't really have a falx cerebri like humans do, but the tentorium it does. Okay, so you see it just kind of peels off here. Watch yourself with the scissors, don't cut your glove. You can help it. And it is very tough, so getting it off can kind of be a little bit of a pain. This is actually the hardest part of the brain dissection, is getting the dura mater off. Especially without mangling the brain itself. So this one still has the pituitary gland attached, but again, when we take the dura mater off, we're going to lose that. They're recording in case you want to get it later. So I've got it off the cerebellum. You didn't miss much. Just trying to cut the rest off the cerebrum. One little guy that wants to hang on there. There we go. And that's going to just peel right off. Okay. So as I come off here, I was just telling Kayla that, see, that's where the optic chiasm optic nerves are going to come through there. It's really hard to get the dura off there. So I'll try to kind of cut around it so we save as much of that optic nerve as we can. But we're going to lose most of the other cranial nerves because those are going through.
So for the practical, obviously the dura mater would be off.
Yeah, it would just be like laying
On the
out there on the
side,
tray.
Can you remind me how many brain questions there are?
5. right?
15.
Oh, 15.
15.
It's 30, 15.
30 muscles, 15 brains, 5 eyes. That's pretty much it. Oh, hey, Kimberly. They're recording, so you didn't miss much, just me taking off the dura mater. So that goes into that fat stuff here, so I'm probably just going to cut that right there. So actually, I'm probably going to use that brain for optic. So that's the optic nerve. It comes together in the optic chiasm. Okay, and as it goes back into the brain here, that's the optic tract. So the different parts there, and you'd have to specify those parts. If we look at the olfactory, so this is the olfactory bulb right there, olfactory tract that goes back in the temporal lobe. So bulb, tract on the olfactory. Those are the only 2 cranial nerves you need to know on the brain. Now, you have to know all of the cranial nerves for your lecture exam. Okay. So, after you go in here, get some of this pia mater off. kind of peel this apart, we'll notice the infamous structure we've talked so much about, our corpora quadrigemini, between the cerebrum and cerebellum. So it's the back of the midbrain. Okay, we see the four bodies, hence corpora quadrigemini. The superior colliculi for visual reflexes and inferior colliculi for auditory reflexes. Remember, unless you're Sloth from the Goonies, eyes above your ears. Cool? Everybody get a good look at that? Corpora quadrigemini?
It's facing this way.
Okay. Questions so far? All right, so all brains should be cut in sagittal section. Cut right down the longitudinal fissure between the two cerebral hemispheres. And we'll come to that structure that Rebecca was talking about. Her sister actually had cut, the corpus callosumectomy they do for seizure disorders sometimes. So if I get some of that pia mater peeled off and then I open that up, see that white matter bridge, much lighter tissue in there between the cerebral hemispheres? See that in there? Okay. Anybody else?
The third ventricle.
See that? So that is the corpus callosum. So again, I'll just continue this cut right down the middle here. Once you get the cerebrum's pretty easy to do, but then once you get to the cerebellum and brainstem, sometimes you can veer off and it doesn't look so good. But we'll do the best. It wasn't too bad. Not too shabby.
Are these under muscles?
No. That's why you're listening. Oh man,
Optic nerve.
that was such a good optic nerve too. Well, it's just going to go over to that one side. You know what it looks like. So now we're looking from the inside here. Several different structures to look at. Oh, we do need to go over the lobes. So frontal lobe, temporal lobe, parietal lobe, occipital lobe. And I'll make them obvious. Okay, so frontal lobe's not going to be stuck there. It's going to be stuck like way up here. Okay. Parietal lobe, like right there in the middle. Temporal lobe, I'll stick it way down here. And occipital lobe, I'll go way back to the back. Again, I'm not sticking a pin there. Okay, so I want to make it obvious as possible. So don't, if you can't tell, and this question will actually specify, it'll ask what brain structure is this, and it'll be written in on the bottom, it'll say lobe. Okay? So if it doesn't specify otherwise, cerebrum. Okay? So I'm asking for the whole thing, unless the question specifies otherwise. Cool? So I guess from outside parts of the brainstem, medulla oblongata, pons, midbrain. Medulla oblongata, pons, midbrain. Okay, and then anything below that would be spinal cord. Cerebellum, cerebrum. Shit. Now you guys got me on video, cussing. You're not supposed to be recording anyway.
10-point curve just went up to 15.
Right. Blackmail. So again, coming on the inside here, so cerebrum, there's that corpus callosum, that top white matter bridge there. You see that, corpus callosum. So again, corpus callosum, I'd probably have to put several pins in it because just putting one pin in it, that's tough. That open space right there, that is the lateral ventricle. So if it goes inside the space like that, that's the lateral ventricle. Okay? You see that? Cool. And again, we see the superior and inferior colliculi back in the midbrain cut in two. Okay, can you see that? So, coming up from the brainstem, we see the thalamus, and then just below and anterior to that, this area here is the hypothalamus. Okay?
Where's the thalamus?
So thalamus, this round structure here, right in there. And that is the hypothalamus. Okay? And I think that's it. That's all. You should have somewhere between 20 and 25